All right, hi, good morning and welcome everyone. My name is Sean and I'll be discussing about diabetic retinopathy. Let's start off first by understanding a little about diabetes. It is a disease that occurs when your blood glucose or sugar is too high. And this can be largely divided into two broad types. Type 1, where diabetes occurs as a result of the inability to produce insulin, or type 2, where diabetes occurs because the body does not make or use insulin well. Of course, there are other forms of diabetes too, such as gestational diabetes, just to name one. Now, let's put this into perspective in Singapore. So a population survey that was done in 2010 showed that 1 in 3 above 65 has diabetes. Also, experts estimate that 1 in 3 will get diabetes in their lifetime. In 2014, 440,000 Singaporeans had diabetes. And by 2050, it was estimated that nearly 1 million Singaporeans could be affected by diabetes. Now, but why is diabetes so important? Diabetic patients can suffer complications that can be broadly divided into medium and large vessel complications, such as heart attack and stroke. And they can also suffer complications with small blood vessels, such as kidney failure and diabetic retinopathy. Diabetic retinopathy is a disorder of the blood vessels in the retina of diabetic patients, and it is the leading cause of blindness in working adults in developed countries, including Singapore. So what is the retina? If we think of the eye as a camera, the retina is the layer at the back of the eye, which is similar to the film in a camera. It helps us to see the world around us. Light enters the eye and is projected onto the retina, and the signals are then transmitted to the optic nerve and then to the brain. In diabetic retinopathy, both peripheral retina and the macula, which is the area in the central retina, both of these areas can be affected. What causes diabetic retinopathy? Changes in small blood vessels results in tiny blood spots and fatty deposits, and a poor supply of blood, oxygen, and nutrients to the retina occurs too. Growth factors are then released, resulting in the formation of abnormal blood vessels in the retina. Who are at risk of diabetic retinopathy? All diabetics are at risk, and this is especially so if one has long-standing diabetes or poorly controlled diabetes. What can you do to prevent diabetic retinopathy? So if you are diabetic, controlling your blood sugar level is very important. It is also important to ensure other medical conditions such as high blood pressure, high cholesterol, heart disease, and kidney problems are well treated. Of course, you should avoid smoking and also perform regular exercises and have a healthy diet. As mentioned just now, diabetic retinopathy affects both central and peripheral retina. And these changes in the peripheral retina can be further classified into non-proliferative versus proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy can be further classified in the mild, moderate, or severe non-proliferative stage. Non-proliferative diabetic retinopathy patients' vision is usually unaffected. Moderate non-proliferative diabetic retinopathy is anything in between from mild to severe non-proliferative diabetic retinopathy. Severe non-proliferative diabetic retinopathy has extensive bleeding spots and blood vessel changes. And once the disease worsens to the proliferative phase, this causes most visual loss in diabetics. Abnormal new blood vessels grow on the surface of the retina and the optic nerve, as you can see here. And these tend to rupture and bleed into the vitreous gel of the eye. Scar tissue can then form, which can pull on the retina, causing retinal detachment and visual loss. New blood vessels can also grow on the iris and cause glaucoma. Moving on to changes in the central retina, diabetic macular edema occurs from leakage of abnormal blood vessels too. And this can also cause visual loss or distortion. How do I know if I have diabetic retinopathy? You may develop a gradual blurring of vision, floaters from bleeding, or central visual loss from macular edema. But most patients with diabetic retinopathy are asymptomatic. And that is why yearly routine eye screening is important for all diabetic patients. And screening is available in all polyclinics, diabetic centers, the Singapore National Eye Centre, and all other tertiary hospitals. Diabetic retinopathy is diagnosed by a comprehensive dilated eye examination. But we also perform other tests, and this includes an optical coherence tomography, which is a cross-sectional imaging of the retina, and it helps us to quantify the severity of diabetic macular edema. We can also perform a fundus fluorescein angiogram, and this also helps us to identify leaking blood vessels. For non-proliferative diabetic retinopathy, frequent monitoring is necessary, and we will usually institute treatment once it progresses to proliferative diabetic retinopathy or diabetic macular edema. The treatment aims to prevent complications and to preserve vision. What can you do to prevent worsening? One may start by improving diabetic control, blood pressure control, and ensure other medical conditions are well optimized too. Also, please avoid smoking and do regular physical exercises and having a healthy diet. If you require treatment, what do we offer? So the treatment can be broadly divided into laser surgery, intravitreal injections, or vitrectomy surgery. Laser treatment in the form of pan-retinal photocoagulation is used to treat proliferative diabetic retinopathy, and this may require a few sessions to complete. Intravitreal injection involves the injection of medication into the vitreous gel in the eye. Multiple injections and frequent follow-up may be required to achieve the best visual outcomes. Vitrectomy surgery is required in severe cases of bleeding and if the patient develops retinal detachment as a result of diabetic retinopathy. Ultimately, prevention is better than cure. And so if you're a diabetic patient, please make sure you attend the annual eye checkups. All right, I've come to the end of my presentation and we'll take Q&A at the end of all talks. Thank you.